Right, welcome back to the 123 show with me, Noreen Mayer, on this Friday afternoon. As I mentioned just now, the very first topic and guest of today, we're talking about conjunctivitis, which is commonly known as pink eye. Now, it's a common eye disease that's known to be quite contagious, and I'm really delighted to be joined once again by Dr. Kelvin Wan, an assistant professor at the Department of Ophthalmology and Visual Sciences at the Chinese University of Hong Kong. Welcome back on the program, Dr. Wan. Thank you so much for joining us.
Thank you, Norina. It's great to be back again.
Yes, oh, perfect. The line sounds very clear. So my first question earlier was, I know it's very basic, but what is conjunctivitis? How would you define pink eye?
Right. So the conjunctiva is a normal structure in our eye, which is covering the transparent part, which we can see when we look into the mirror. It overlines the whitish part of our eye. It covers from the front and also the inner lining of our eyelids. So when the conjunctiva gets inflamed, we call it conjunctivitis, or known as the pink eye.
Oh, okay. And how common is this disease?
It is extremely common. I'm sure we all know somebody that has had this condition. It's as common as the flu. And in fact, it's actually a lot of time it occurs together with the flu because the conjunctivitis most commonly is due to some viral infection. And the virus is the same virus that makes us get the flu. So it's very, very, very common.
Oh, wow, that's shocking to hear. Oh, gosh, I hope I don't get it. But like you said, it's probably something that will happen in our lifetime. Now, I mean, what are some of the symptoms to look out for pink eye and conjunctivitis?
So like the name implies, your eye will become a little bit pinkish and reddish. So perhaps let me share the screen.
Yes, we are, by the way, we are on Facebook Live this afternoon, Noreen Mayer on RTHK Radio 3. I'd really love to invite our listeners to be viewers this afternoon as Dr. Kelvin Wan shares a presentation with us on Facebook and showing us a very pink eye. Oh, that looks so sore.
Yes, it looks very pinkish, reddish, and the patient will have a lot of discharge and discomfort too. A lot of tearings, usually clear in color, and sometimes when it gets more severe, it can actually blow up like a balloon, like this case. So
Oh
the
my
conjunctiva,
goodness.
yes, it's very. It looks very scary sometimes because the lining becomes filled with fluid when it becomes inflamed. So it's like a balloon blowing up.
I'm just going to explain this for our listeners on the radio. So it's kind of like the bit which is your eye white, kind of like balloons out and bulges out of the eyes. That's really scary.
So just imagine when they close their eye, you can still see something coming out because the conjunctiva is all ballooned up in these cases. So apart from these, the patient will be in some discomfort. Usually they'll feel maybe their eye is very full and they feel some sand in their eye because the conjunctiva is a lot swollen and bigger than it normally should be.
Oh my goodness. So how do you get conjunctivitis? You mentioned just now it's sort of viral, bacterial. Can it be caused by bacteria as well?
It's usually due to some viruses, as I mentioned, from the flu virus, which makes you get the cold. So we get it in our eye because a lot of times we like to rub their eyes and we like to touch our eyes. So especially now during COVID, I think we all need to be more careful and more aware not to rub our eyes. So it's transmitted based on these. Based on the contact with some contagious fluid, most commonly from the tears that get secreted. So, for example, it's very common for the patients to have one eye having conjunctivitis, but because they use the towels, sometimes maybe to wipe their face on their hands, and then maybe a few days later, they get it on the other eye as well.
Oh.
I remember seeing actually a whole family having conjunctivitis because one of their members caught it, and maybe they were touching things in their home and they didn't have these good hygiene practices and they all touched their eyes, so the whole family caught it.
That makes a lot of sense because I remember when we were little, if a kid at school had conjunctivitis or pink eye, we were told not to look at their eye because it was contagious if you look at it. But that's a rumor. It's not true. You have to physically touch the eye and
Yes.
transmit the droplets in order.
But that's a good way to scare kids and make them aware of how contagious this can be.
Yeah. Do you remember that when you were young? Did people say,
Yes,
"Don't
yes.
look at, don't look at that
Yes, and you
eye"?
get it.
So, who's more susceptible to get pink eye?
So maybe sometimes the patient, when they go swimming without wearing swimming goggles, they can catch it from the swimming pool. And also, though, sometimes when they share common utilities, sometimes in the for example, when they go to the gym and then they use the towels, for example, if the towels aren't clean, they can catch it like that too. So I think those the people that are more prone, who likes to rub their eyes, and those who share some common hygienic products with others will be more likely to get it. But as I said, it's very contagious and very common. So it's as common as the flu. So we're all prone to it, and we all know somebody that has had this condition, I think.
Absolutely. And how long does conjunctivitis last for then?
Usually the symptoms is most severe in the first week or so, but so it lasts about a week. But even when the symptoms starts to subside and it gets better, you can still transmit it to others. So the whole transmission period can probably end up to until 2 to 3 weeks.
Whoa, 2 to 3 weeks.
The whole span.
Wow.
Yes.
So
usually the symptoms is most severe in the first week.
Okay. So should I go see a doctor if I've got conjunctivitis?
You should, because there are treatments the doctor can prescribe to the patients to make them to make the symptoms get better, to help them improve their symptoms. And also, as you mentioned earlier, sometimes it may not be due to some virus. It can be due to bacteria. And if the conjunctivitis is caused by bacteria, it actually is a lot more severe. So, like this photo here, you can see the discharge is all very yellow. Yeah, you can actually literally have pus coming out of your eye. And in very, very severe case, you can damage the cornea, which is the transparent part, because these bacteria can eat through and penetrate into the cornea. Yeah. But these are more extreme cases, but I have seen a few in my career.
Oh my goodness.
So that's why you need to see a doctor if you have conjunctivitis, because it can be due to some serious bacteria as well.
Yeah. What is the process for checking for pink eye and conjunctivitis? Because maybe sometimes it's just your eyes are irritated, so it has, you get the pink eye. What's the process for the checkup?
So usually we examine the conjunctival lining to see the sort of damage it has on the eye. So sometimes in severe cases we can see like a membrane on the eye, and we also take a swab. So it's like a cotton tip, but of course it's sterile. And then we swab the lower part of the eyelid to take some samples to see what kind of a causative agent is causing this. So the doctor will examine the patient, and if necessary, they think it's due to some non-viral causes. Then they will take some swabs to see whether it's due to some bacteria.
Okay, when you mentioned about the cotton swab under the eye, it made me think of, sometimes people, when they put eyeliner on their eyes, that's why people shouldn't share eye makeup, the eyeliner or mascara, because it's so easy to transmit diseases.
That is also another way females can contract this disease.
Exactly. It's like, can I borrow your eyeliner? No, you can't.
Yes. Especially in those makeup stores, you can try the eyeliner. So that's definitely a way you can get it.
Yes, you're absolutely right. When you go to different places, makeup beauty chains, and you can try the tester, people can sometimes contract diseases like this. So how is it being treated then? How can the doctors prescribe some relief and for the discomfort?
So usually we have some eye drops that we can give to the patient, which will improve the symptoms of itchiness. And the doctors will also prescribe some eye drops containing some antibiotics to prevent some bacteria from also getting into the eye when the eye is all inflamed. But most of the time, it usually can get better on its own. So it's like the flu. Actually, you don't need to take any medication to treat the flu. So similarly, you don't need to take any particular medication to treat the conjunctivitis, but there are eye drops we can give to the patients that will help them make them feel better.
To alleviate the dryness.
To alleviate the symptoms. Yeah. So it's like when you have a cough, we give some symptoms to treat the cough. Yeah. But the virus, when you get the cold, our body, normally our immune system can fight it off.
Yeah. So can you be immune to it then? I mean, once you have it once, can you kind of like the flu, you're immune to it for the season or you just keep getting it?
Yeah, you can get it again. You can actually get it again. I remember apart from those family, sometimes when the first household get better, and then they transmit to the other household, and then once they get better, they can get it back. So I remember seeing that some families that have the whole duration last for like 1 to 2 months because of the repeated transmission within the same household.
Oh, wow. Well, Dr. Wan, they always say, prevention is better than cure. So finally, my last question is what sorts of recommendations do you have as a doctor for our listeners to, reduce the chance of getting conjunctivitis?
So be very aware that when you touch your eyes, make sure you clean your hands and wash your hands thoroughly. And especially now during COVID, we should avoid touching our eyes and our face, not only to prevent the flu, but prevent from other viruses like COVID as well.
Absolutely. Well said. Well, thank you so much for your time this afternoon, Dr. Wan. I really enjoyed talking to you. And for our listeners, this afternoon we were chatting with Dr. Kelvin Wan, an assistant professor at the Department of Ophthalmology and Visual Sciences at the Chinese University, talking about pink eye. Thank you so much for your sharing, and I look forward to inviting you back on next time again.
Thank you very much, Noreen.